You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. When it comes to stroke, the statistics are eye-opening. The Centers for Disease Control and Prevention reports the following. Every 40 seconds, someone in the United States has a stroke. Every 3 minutes and 14 seconds, someone dies of a stroke. Stroke is a leading cause of serious long-term disability. And 1 in 3 U.S. adults has at least one risk factor for stroke. Stroke can also happen to anyone at any age. In this episode of Plug Into Health, we have 2 experts who are on the front lines of stroke every day. Prevea Health Neurointerventional surgeons Dr. Alison Meyer and Dr. Collin Torok care for stroke patients at HSHS St. Vincent Hospital in Green Bay, Wisconsin. What do they want us to know about stroke? And what resources do we have right here in Green Bay, Wisconsin to help those impacted by stroke? We're going to cover all of this and more starting now. Drs. Meyer and Torok, thank you for joining us. Let's start with this. What is happening in someone's body when they're having a stroke, and why does it happen?
Yeah, sure, I can comment on that. So basically, there are 2 major types of stroke, ischemic stroke and hemorrhagic stroke. What happens in an ischemic stroke is that a blood vessel in the brain gets blocked by a clot. For a hemorrhagic stroke, a blood vessel bursts in the brain and causes a brain bleed. I would say that probably most people are familiar with the former, ischemic stroke, and that's what we'll focus on today. And the source of a clot can come from various locations. A common location is the heart. If a patient has an arrhythmia or abnormal heart rhythm, clot can form that then travels up into the brain. Also, there are a variety of other sources from plaque forming in the arteries of the brain, neck, and chest.
What are the signs and symptoms we should be looking for within ourselves or others?
Right. So stroke can manifest in a variety of different ways, but in terms of screening and what to look out for, we try to keep it simple and efficient. So an example of that is the FAST screening tool for stroke. And that stands for facial droop, arm weakness, speech abnormalities. And time is just a reminder of the fact that outcomes are extremely time sensitive. Another iteration of that is B-FAST, and the B is for balance, so any acute changes in balance, and E is for eye, so any acute vision changes are additional things to look out for.
What is the first thing you should do if you think you or someone you're with is experiencing a stroke?
Call 911 and get to the hospital as quickly as possible.
I wanted to interject here that it's very common for the person who is actually experiencing the stroke to not recognize what's going on with them. So it's usually for these recommendations are for the people that are seeing that person. I've actually had patients who have actually denied that they were having a stroke vehemently, to the point that they're being brought in by EMS and screaming at EMS that they're not having a stroke when in fact they were having a stroke, because the brain wants to shut down to these symptoms. So unlike heart attack, at one point they called stroke brain attack, but the difference is that the muscle of the heart hurts when it's dying. The fat in the brain doesn't hurt. So it's really just these symptoms that people have. And many times the person who's having those symptoms tries to ignore it or deny it. So it's very important that the people around them understand the symptoms that they are seeing and alert 911.
I was going to add as well that even if a patient does realize that they are having symptoms, those symptoms can occasionally abate temporarily. It's still important to call emergency services and get into the hospital to have a complete evaluation.
And where you receive care matters. Let's talk about HSHS St. Vincent Hospital as a certified comprehensive stroke center. What does that certification mean, and why is it important?
So what it means is that obviously there are regulations, but not to boil it down simply. It means that there are people like Dr. Torok and myself that are interventional neuro people who go in and physically remove those clots. So it gives, it extends time windows, for example, where the clot busting medication can only be given up to a certain amount of time. We are able to do things for a little bit longer than that. And then that also means that the care after you're having your stroke, such as the ICU care and the rehabilitation, are all at a higher level because we cannot refuse stroke. So we are receiving from pretty much a large area because there are 3 comprehensive sites. The one thing I will say about our program is that we look at every single patient and we are very aggressive at wanting to treat those patients to the best of our ability. There are times when people will say, you only are going to do the simple stroke. We are very comprehensive with Dr. Torok here. We are covered 24/7, for example. That's one of the other things, is that we can never refuse care for that time period. And like I said, we have a robust imaging that the minute you come in, and I know this kind of dovetails to one of your other questions that you have for me today, is what happens when somebody comes in. And when they come into our system, we are going to image very, very quickly because, like Dr. Torok said, the time is of the essence. And so we start the minute the patient comes in. Many times they are going straight to our CT scanners, where they're going to get basically 3 studies. A CT that's going to be looking at the brain, a CT angiogram that's looking at the blood vessels, and a CT perfusion that is looking at how the blood flow is going through the brain, so that we see where the blockages are, where we can go and try to take them out, and if we're capable of doing that in a time-effective way. And then we determine and we tailor our approach and our treatment to the patient at that point.
And what are some of the other specialists, advanced technologies that you have at your disposal to assist patients with stroke?
So we have a dedicated neuroradiology team that is reading those films that we just talked about. Obviously, you have the neurointerventionalist. That's us. Neurology, neurosurgery is part of our team. The ER, we can't forget them, and then all of the nursing and technical support that goes to all of those specialties.
And you had mentioned this earlier at HSHS St. Vincent Hospital and in partnership with Prevea Health. We can truly offer a full spectrum of care from the moment they come in to their needs of rehabilitation, follow-up care in clinic. Can you kind of paint a picture of what that might look like?
So one of the things that happens, obviously, stroke is a devastating thing. It's not just that it will kill you. It's that it generally, most people make it through, but unfortunately, it takes a lot of neurologic, makes people, disabled. And even when we do the best job we can, there may be weaknesses or in certain places. And so depression comes with that because it's one of the things that people really don't, I will tell you, my parents are elderly and it's their worst fear is to have a stroke. They don't care that they might die. They care if they're going to be disabled and dependent on their family for their cares. So what we try to do, so we're knowing that, we try to get people mobilized literally as soon as we can, so the next morning. And we have a wonderful physical therapy, occupational and speech therapies that come to the bedside, starting to evaluate that patient. And we try to move them quickly to our wonderful rehab, which is led out by Rose Turba and her team. And they are amazing at getting patients back on their feet because if we go, we know that if we win, if we get to rehab, we know that they're going to be going home because that is the goal of rehab. So we really like to do that, and they're intense, but it's a good thing. And then we follow patients up in our clinic. So we do all the follow-up for the stroke patients. We see them at 2 to 3 weeks after they are discharged. If they're discharged from rehab, it'll be after they go through their rehab.
Mm-hmm. What do survival rates and outcomes for stroke look like today?
Right, and to echo some of what Dr. Meyer had mentioned, our goal in stroke care, of course, always to return patients to their baseline functional status. But again, beyond being life-threatening, it's a severely disabling disease. So essentially, even if you survive and have a major stroke, you can be dependent for your most basic needs on assistance for the rest of your life. So the impact is very large. In terms of the statistics, for large vessel occlusion, which again is what we primarily treat with catheter-based therapies, the rate of not surviving or being dependent within 3 to 6 months is about 64%. So it's a very high morbidity mortality for this disease. But thankfully, we, with our modern endovascular treatment technology, the likelihood of having a more favorable outcome has essentially doubled. So it's been a real paradigm shift, and it's one of the most rewarding procedures that we perform.
That was going to be, it's not on the list, but talk to me about, there's got to be some really rewarding parts and moments of your jobs.
Absolutely, and I'm sure Dr. Meyer can comment as well, but in many of these cases, I should say, you see such a rapid improvement from a patient who can't speak or move, and then they're back to normal that the same day or the next day, and that's really hard to match. And truly, this is one of the most effective treatments in all of medicine.
Yeah, I was going to add to that. When we look at heart attack and what the super interventions that are performed for heart attack, it takes about one patient for 12 patients for one really good outcome. For what we do, it takes 2 patients for one really good outcome, and that is amazing. If you think about we call that in medicine, we call that the numbers to treat. The numbers to treat here are 50% are going to improve with doing intervention, which is just amazing. And like Dr. Torok was just saying, it's people say, how can I thank you? And I go, the way you can thank me is living a good life, because there's very few things in medicine where you can take somebody who is literally dying in front of you and you can take them back to functional status and be normal, and back to their family and back to their life that they were having. And that's just amazing, and it's just very rewarding from that standpoint. I don't think there's anything in medicine quite like it. Obviously, stroke is a devastating thing, and we get to see, unfortunately, we do see people that are too far outside of our windows because they didn't come in time, and that always makes. I think that's one of the frustrating parts of my job, because I know that I could have helped them if we had just gotten them in time, and that's why we're here talking about this, because we need to make sure that people are aware, because it doesn't hurt. People want to go to sleep. They don't, they're not going to come and tell you that they're, hurting or doing badly. They're going to try to shy away from their symptoms. And so it's really important for everybody to be aware of this disease, because we have such a robust set of tools that we can do to really help people.
So as 2 people who are on the front lines of what can be such a devastating disease occurrence every day, you're on the front lines of this. What are your messages for our listeners when it comes to stroke? Core things, key things you want them to take away from this?
Yeah, I think some of the highlights of what we've sort of reviewed, certainly awareness, and as Dr. Meyer pointed out, the stroke patient may not be aware of what's happening, so especially friends and family knowing what to look for, I think is the biggest message that we want to convey today. And then what to do when you notice that there's a problem. And of course, that's immediately to call 911 and seek medical attention.
And knowing that stroke can happen to anyone. It's not just for people of older age. It really can happen to anyone. Do you think that there is sort of a common thought that people think stroke only happens to my grandparent or an older relative?
I mean, we definitely have, obviously, because of stroke, we are dealing with an elderly population, but I've had stroke in children. So if you see the symptoms of face, arm, speech, or eye movement that is not correct, we should be getting, even if it turns out it's not a stroke, we should definitely need to be looking into that. And if you are having symptoms that are intermittent, just like what Dr. Torok was saying, that kind of come and go, it's easy to dismiss. It's easy to say, oh, I just slept wrong. That's the one I hear a lot. I just slept wrong. I'm like, yeah, when you fell, did you think you just slept wrong? And so, because we really don't want to be sick. We don't want, that's we don't want it to interfere in our life. And I completely understand that, but having a major stroke will not just be an interference, it'll be an absolute overwhelming change in your life and dependency. And so if you are having symptoms, even if they're intermittent, because sometimes that helps us to, I always ask the question whenever I give a talk, when is the best time to treat a stroke? And it's always before it ever even happens. Mm-hmm. So if we can get you before you even have that stroke, that's the best.
Is there anything we can be doing from a lifestyle perspective to help prevent stroke?
Well, the kind of the commonsensical stuff of getting rest, exercise, and eating well. I'm a very strong proponent for a balance of things, because if you told me I couldn't ever have a piece of bacon ever in the rest of my life, I'd probably hate you. But everything in moderation. Obviously smoking cessation is super important, and those sorts of commonsensical healthy lifestyle things are really important. You can't take away genetics, so if you have a family history of heart disease and stroke, that does mean that you have to be a little bit more on the heightened awareness that if any of these symptoms occur, you should probably be being checked out.
Is there anything we haven't talked about here that you want to address?
I think we've sort of covered the major points, but one other thing I would add, just going back to the awareness side of things, I find myself thanking the patients' families profusely whenever we do these interventions, because we know that if they didn't get to us in time, we could do the best job possible in the angiography suite. But because the clock starts ticking as soon as the stroke happens, that really comes back to the importance of the awareness and getting to the hospital as quickly as possible.
I will share a little story. There was a younger patient, so a mom had just delivered her baby, and she was having a stroke. Her 9-year-old recognized it because they had just had at school, they had just had somebody talk about stroke, and he saw her face drooping, and he called 911. It was one of the most poignant 911 calls I will ever remember. And when he was at bedside, because it was obviously they didn't want the kids in the ICU with her, we allowed him to come in because I wanted to give him a big hug. Because, like Dr. Torok is saying, it's and that's what I mean. It's those family members, and here it is, a 9-year-old saved his mom. So it can be anybody that just raises that flag, and it's important because if he hadn't gotten her in, she probably would have been at home for the rest of the day and wouldn't have made it. So that's pretty incredible. Yeah, incredible.
I want to thank you both, not only for your time of coming here today and sharing all these important messages with our listeners, but truly thank you for everything that you do for our patients every single day.
Thank you for having us so that we can get this message out.
Thank you very much.
And thank you to our listeners. We invite you to visit Prevea.com/stroke to learn more about stroke, the Prevea Neurosciences team, which includes Drs. Meyer and Torok, and the numerous other specialists, including Prevea vascular surgeons who specialize in stroke-related care. You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit Prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at Prevea.com. Thank you for choosing to plug into health with Prevea Health.